Hi everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to talk about what is the meaning of those noises, those clickings and clunkings that you hear after your knee replacement surgery. Everyone, so today we're talking about the noises that you hear after you have your knee replacement surgery. So those noises that you're hearing in your knee joint, typically described as a clicking, maybe sometimes a little bit like a snapping sensation, sometimes even a clunking noise, people might describe it as. And what is the reason that you are potentially hearing these sounds and these noises? Well, there's usually a couple different potential causes for those sounds. So one is it could be the actual components of your new knee. So your new knee is made up of metal components and plastic components. And as your knee is healing, there's different amounts of fluid, different amounts of swelling. Things are changing and adjusting. The shape of the knee, the shape of the joint, as the swelling ebbs and flows, as the tendons and the soft tissue adjust to different lengths, and as muscles get stronger, as all these things are changing, what happens is the mechanics of your knee are not really kind of set yet, so to speak. They're kind of adjusting and changing as the knee and the dynamics of your knee change. And what can be happening is basically those components, that metal component or those plastic components, are rubbing and kind of hitting up against each other. And that's where that clicking sound potentially could be coming from. A lot of times it might be the kneecap. So if you have the back of your kneecap resurfaced, there's that plastic part, and that might be hitting up against the metal component of your thigh bone, of your femur. It could be the other metal components are touching each other. So the first potential reason is that the different parts of your new knee are hitting up against each other as you're walking and moving. Another possibility is that you're hearing the swelling in your knee. So basically the swelling and the tissues are changing, and again, this is changing the dynamics of the knee. So some of that noise might just be due to the different movements and the different dynamics caused by the swelling that is present in and around your knee. And the other main potential reason is that when you have a knee replacement, you're changing the anatomy, you're changing the mechanics of the knee. Maybe significantly, maybe slightly, but you're still changing the mechanics. And what that does is it puts different amounts of tension and different amounts of stretch on the soft tissue around your knee joint. So your tendons that run along the sides of your knee and on other parts of your knee, your ligaments, these soft tissue structures are basically adjusting to the new knee that you have. They're lengthening, they're very tight potentially, and they're basically resetting themselves to adjust to the normalcy of your new knee. So what happens is that these might be kind of snapping or clicking as they maybe click or move over different parts of your knee replacement or bones. That could be another potential cause of these noises. Now, for most people, the noises are of no concern. They're a little bit frustrating, a little bit annoying, but typically they're not any reason to be concerned or worried or discouraged. Typically, over time, the noises tend to diminish more and more. A lot of people will get to the point where they don't even hear the noises anymore. Sometimes you still have the noises, but they're hopefully diminished over a couple of months, a year, a few years out from surgery. And what that means is basically the knee and the soft tissue structures and everything is really starting to adjust and adapt. And then furthermore, your body is building strength. So your quadricep muscles, your hamstrings, the muscles along your calves, in your calf, these muscles are building strength, which are providing some more stability around the whole knee joint. So if you have that stability, you have a little bit less motion and less of that noise subsequently. So when should you be concerned? So again, normally it's really no concern in the noises, but if you do notice a onset of new significant increased pain that is accompanied with the noise, or swelling that is accompanied with the noise, this is a reason you might want to reach out to your doctor. If you notice deformity of the joint, so the positioning, the alignment of the joint, or a new bump or whatever it may be, that might be a reason to be concerned and to consult with your doctor. And also any new kind of sudden onset of noises. So if you're 3 years out, 5 years out from surgery and you never really had any noises, or the noises have gone away, and then all of a sudden you have kind of this new onset of clicking and clunking sounds, that might be a reason to consult with your doctor as well. There is something that I do want to touch on quickly, which is called Patellar Clunk or kneecap clunk. And this is kind of something that's very specific. So it's basically underneath your kneecap, underneath your patella, there could be a development of some scar tissue after surgery. And what can happen is that scar tissue can inhibit the ability of your kneecap to move and glide smoothly on top of your thigh bone, on top of your femur. And so what can happen is this can be very painful, it can limit your motion, and a lot of times people will kind of describe this clunking sensation. They feel it and they hear it. And this is something that is definitely worth talking to your doctor about and consulting with your doctor about. Sometimes it resolves on its own or with some physical therapy. Another option is to have surgery, to actually arthroscopic surgery, to remove some of the scar tissue that has developed under the kneecap, and to help improve motion and get rid of that clunking sensation. So that's just one little caveat, one little unique circumstance to be aware of. So that's all the different things to think about when it comes to the noises that you're hearing after knee replacement surgery. Again, usually harmless, usually goes away over time, but be aware of some of the things that may be worth consulting with the doctor about. Thank you very much for watching, everyone. Have a great day.